Hi, my name is Janice Clark and I'm a lactation counselor. I'm here to review how to relieve engorgement. Engorgement occurs when milk is in your breast for too long and it doesn't get removed frequently enough. And it can also happen not too long after you deliver your baby and your milk supply is increasing. So we're going to review some tips on how to relieve engorgement and how to make you more comfortable. The first step to alleviate engorgement is actually to prevent engorgement. You could do so by breastfeeding your baby at least 8 times in a 24-hour period. You might see that your baby will feed somewhere between 8 to 12 times in a 24-hour period, and that's totally fine. So we always say to watch your baby and not watch the clock. You don't have to wait for your breast to get overly full before breastfeeding. Look out for hunger cues, such as your baby waking up, your baby sticking their tongue out their mouth, or your baby sucking on their fingers or moving their head from side to side. Those are all hunger cues, and that's how you know when to feed your baby. Sometimes when you're experiencing engorgement, your breast becomes too firm. And once it's too firm, your baby has a hard time latching on. So you want to soften your breast. There's a technique called reverse pressure softening, which pushes back the excess fluid in your breast. So in order to do reverse pressure softening, you take your 2 fingers around your areolas and you push back your breast for about 1 minute. Once you do this, your breast might get soft, or you might have to rotate your hands a little bit to soften another area, and you hold for another minute. Another way to relieve engorgement is by using a warm compress and gentle massage. So before latching on your baby, you want to gently massage your breast so that you are gently stroking your breast towards the nipple, and that's to encourage milk flow. You could also use a warm compress, which also helps to encourage milk flow. This should make it easier for your baby to latch on. And remember, gentle strokes are best. You don't want to leave bruises on your body. If after breastfeeding your breasts still feel too full, you can use hand expression to alleviate the excess milk in your breast. So when you hand express, you put your hand in the C position. You put your fingers around your areola, not too close to the areola, but not too far either. And you push back against the breast wall and you compress your fingers. You might have to do this a few times in order to see milk flow. So after you hand express, you want to hand express until you relieve enough milk and your breasts feel comfortable. Sometimes using a breast pump can contribute to feelings of further engorgement. Another step to relieve engorgements is to use a cold compress after breastfeeding. Using a cold compress for about 10 to 15 minutes after breastfeeding can help to reduce the swelling and any inflammation you feel in your breast. The last step to taking care of engorgement is by taking care of you. Remember, you are wonderful, you are amazing. Eat, rest, and hydrate, and get the support you need in order to take care of yourself. If for some reason the engorgement is lasting more than 24 hours, you develop flu-like symptoms or a fever, contact the New York City Breastfeeding Warm Line or your healthcare provider for further instructions.